there's a subtle but persistent shift many women observe as they navigate their later years. It's not always dramatic, but it's undeniable. A widening part line, the increasing visibility of scalp, or perhaps the familiar sight of more strands than you'd like clinging to the shower drain after every wash. This experience often brings a quiet frustration, sometimes even a deeper apprehension, fueled by the common assumption that significant hair thinning is an inevitable consequence of aging. You might have found yourself thinking, this is just how it is now, or the vibrant density I once had is simply gone, and there's nothing left to do. Yet what if this isn't solely about the passage of time? What if the primary drivers behind changes in hair density and strength are often nuanced physiological responses to daily habits and environmental factors that become uniquely impactful as we mature? This isn't to dismiss the biological realities of aging, but rather to illuminate that the state of your hair follicles, those microscopic living structures within your scalp, are highly responsive even at 60 and beyond. In fact, many seemingly benign actions or even perceived healthy choices can inadvertently create an environment that challenges optimal hair growth. This subtle long-term stress on your follicular system can over time lead to a prolonged resting phase for hair, reducing overall density and visibly affecting texture. Stay with me here because this insight is often overlooked. We're going to explore several key contributing factors that impact hair health, particularly in mature women. These aren't just surface-level observations. They delve into the internal mechanisms that govern hair growth and retention. By understanding these dynamics, you'll gain clarity on why your hair may be behaving differently now compared to your younger years. And importantly, what precise shifts can help foster a more supportive environment for its vitality. This might sound technical, but here's what it means practically. Empowered knowledge for intentional choices. One crucial consideration often begins with how we care for our hair externally, particularly with respect to cleansing routines. Many women understandably focus on cleanliness, maintaining habits established decades ago. However, your scalp's physiology evolves with age. Postmenopausal shifts, for instance, can lead to a significant reduction in sebaceous gland activity, resulting in less natural sebum production. Sebum is your scalp's inherent protective and moisturizing agent, forming a vital lipid barrier that safeguards the hair follicle and maintains scalp health. When this protective layer is frequently stripped away by robust cleansers, especially those containing harsh sulfates commonly found in many clarifying or volumizing shampoos, it can lead to a cascade of issues. The scalp can become excessively dry, prone to irritation and inflammation. In practical terms, this can manifest as that tight, itchy sensation after washing, which isn't just discomfort, it's often a signal of compromised scalp integrity. Chronically inflamed follicles are less efficient at producing healthy hair, potentially leading to premature shedding and miniaturization over time. The solution here involves a nuanced adjustment, reducing wash frequency, perhaps to 2 or 3 times weekly, and selecting ultra-mild, sulfate-free shampoos that are specifically formulated to replenish moisture rather than strip it. Ingredients like argan oil, hyaluronic acid, or ceramides can support the scalp's natural barrier function. On non-wash days, a gentle rinse with water or a strategically applied dry shampoo can maintain freshness without overstressing the follicular environment. This shift alone can create a notably more hospitable foundation for hair vitality. Another equally relevant aspect contributing to hair fragility in mature women involves the routine application of heat. After 60, the hair shaft itself undergoes structural changes. It naturally tends to become finer, and its protective outer cuticle layers, which act like shingles on a roof, can become more compromised. This makes the hair far more susceptible to damage from thermal styling. When direct heat from flat irons, curling wands, or high-setting blow dryers is applied to these delicate strands without adequate protection, it initiates a process known as thermal degradation. The keratin proteins that form the hair's core structure begin to denature, much like an egg white solidifying when cooked. This structural alteration is largely irreversible and can lead to brittleness, breakage, and a dull appearance. Here's where this becomes clinically important. The impact isn't confined to the visible hair shaft. The intense heat can also conduct down the hair strand to the delicate hair follicle within the scalp, potentially contributing to follicular inflammation and accelerated miniaturization. This means the follicle gradually shrinks, producing progressively finer, weaker hair until it may cease production altogether. If heat styling is a regular part of your routine, even just once or twice a week, it can significantly accelerate this decline. The practical integration of this understanding involves several adjustments. Prioritizing air drying whenever feasible is highly recommended. Exploring heatless styling options, such as gentle braids, soft rollers, or pin curls, can also yield beautiful results without thermal stress. When heat is absolutely necessary, a high-quality heat protectant spray containing ingredients like silicones or hydrolyzed proteins to create a protective barrier becomes non-negotiable. Furthermore, lowering the temperature settings on your tools is critical. Aiming for 300 degrees Fair, 150 degrees Celsius or lower, is often sufficient for mature hair, rather than the higher settings typically used on younger, more resilient hair. This isn't about abandoning styling, but adapting methods to respect the hair's current biology. This next piece explains why even a diligent external care routine might not fully address thinning hair. We must consider the profound internal influence of persistent physiological stress. While stress is a universal experience, its impact on the body, particularly the hair growth cycle, intensifies with age due to shifts in hormonal regulation. When the body perceives chronic stress, it activates the hypothalamic pituitary adrenal (HPA) axis, leading to sustained elevation of cortisol, often termed the stress hormone. While acute cortisol spikes are a normal adaptive response, prolonged elevation can be highly disruptive. In terms of hair physiology, elevated cortisol levels are associated with increased systemic inflammation, which can extend to the scalp environment. More critically, high cortisol can prematurely shift a significant number of hair follicles from their active growth phase, anagen, into the resting or shedding phase, telogen. Normally, about 85 to 90% of your hair is in the anagen phase at any given time. However, under chronic stress, this ratio can invert, pushing a larger proportion of follicles into an early telogen phase. The consequence? Approximately 6 weeks to 3 months later, a noticeable diffuse shedding can occur, a condition known as telogen effluvium. What's often missed is that if this chronic stress continues, these prematurely resting follicles may struggle to re-enter the active growth phase effectively, potentially leading to prolonged dormancy or, in some cases, permanent miniaturization. This isn't just about significant life events. The cumulative effect of daily, low-level stressors, financial concerns, caregiving responsibilities, or even sleep deprivation can contribute to this internal imbalance. Therefore, actively integrating stress reduction practices into daily life becomes a foundational element for supporting hair health. This includes techniques like daily mindfulness or deep diaphragmatic breathing, consistent moderate physical activity, and prioritizing 7-8 hours of quality sleep. Additionally, discussing adaptogenic herbs like ashwagandha or rhodiola with a healthcare provider might be a supportive option for managing the body's stress response. This proactive management is not merely a lifestyle choice. It's a biological imperative for follicular resilience. Beyond daily habits and stress, an often overlooked area concerns pharmacological influences on hair health. Many women over 60 manage various health conditions, and while essential, certain medications can have hair thinning as a potential side effect. This is where many people are surprised. Common prescriptions for conditions like hypertension, high cholesterol, depression, and even certain hormonal therapies or blood thinners are associated with alterations in the hair growth cycle. For instance, some beta blockers for blood pressure, statins for cholesterol, selective serotonin reuptake inhibitors, SSRIs for mood, and even certain thyroid hormone adjustments can influence follicular activity. The challenge lies in the fact that healthcare providers prioritize vital organ function, and understandably so. However, understanding the potential impact on hair allows for an informed conversation about alternatives or mitigation strategies. A critical step is to review all current medications and supplements with your doctor or pharmacist. In some cases, a different class of medication or an adjusted dosage might offer similar therapeutic benefits with a reduced impact on hair. For instance, certain ACE inhibitors might be better tolerated by hair than some beta blockers. Similarly, specific supplements, while seemingly innocuous, can sometimes contribute to hair concerns if taken in excessive amounts. Vitamin A, selenium, and even vitamin E, if oversupplemented, have been linked to hair changes. This means obtaining a comprehensive nutrient panel blood test to identify specific deficiencies before broad supplementation is a prudent approach. It's also crucial to remember that medication-induced hair changes often have a delayed onset, appearing weeks to months after starting a new drug, and recovery can also take a similar time frame once the offending agent is adjusted or discontinued. This nuanced approach ensures that necessary medical care is harmonized with efforts to support hair vitality. Here's what often gets overlooked: the intricate connection between systemic health and hair integrity. Thinning hair can frequently serve as an early indicator of an underlying health condition that requires attention. Many subtle physiological shifts that become more common with age, if left unaddressed, can profoundly disrupt the hair growth cycle. Consider thyroid disorders, particularly subclinical hypothyroidism, where thyroid hormone levels might be at the lower end of the normal laboratory range but are insufficient to support optimal cellular function, including that of hair follicles. Iron deficiency, even without full-blown anemia, can significantly impair oxygen transport to the hair matrix cells, which are among the body's most metabolically active. Deficiencies in vitamin D, zinc, or even specific B vitamins like biotin, all crucial cofactors for keratin synthesis and cellular replication within the follicle, can similarly compromise hair quality and density. Autoimmune conditions, hormonal imbalances following menopause, especially concerning estrogen and progesterone levels, and even early-stage insulin resistance or diabetes can create systemic inflammatory environments or disrupt nutrient delivery that directly impacts hair. The insidious nature of these conditions is that their initial symptoms, fatigue, subtle mood changes, or general malaise, might be misattributed to just getting older. This is the part many women overlook: the importance of thorough, proactive diagnostic evaluation. Standard lab ranges are often broad and may not reflect optimal levels for hair health. Therefore, a comprehensive diagnostic approach should include a full thyroid panel, 2SH, free T3, free T4, and thyroid antibodies, an iron panel with ferritin, and assessments for vitamin D, B12, and zinc. Should these initial tests be within normal but not optimal ranges, or if hair thinning persists, further investigations into inflammatory markers or detailed hormone panels might be warranted. Identifying and appropriately managing these underlying health conditions not only supports hair regrowth, but also contributes significantly to overall well-being. The hair is often a messenger for the body's deeper narratives. Now, we arrive at a foundational element, arguably the most critical pillar for supporting hair health, especially as we age: optimizing our nutritional intake, particularly protein and specific micronutrients. This isn't merely about general health. It's about providing the direct building blocks for hair synthesis. Your hair is primarily composed of keratin, a fibrous protein. For your body to manufacture this keratin, it requires a consistent and adequate supply of complete protein, along with specific vitamins and minerals that act as cofactors in its production. Yet, after 60, several factors converge to make meeting these nutritional requirements more challenging. Appetite may naturally decrease, digestive efficiency can lessen, affecting nutrient absorption, and dietary restrictions or preferences might inadvertently reduce protein intake. What this looks like day to day is that many mature women are simply not consuming enough high-quality protein to support robust hair growth. A good general guideline suggests aiming for at least 0 to 1 boat, 2 grams of protein per kilogram of body weight daily. For example, a woman weighing 150 pounds, approximately 68 kilograms, would ideally need between 68 and 82 grams of protein per day. This protein needs to be complete, meaning it contains all essential amino acids found in sources like eggs, poultry, fish, lean meats, dairy, and thoughtfully combined plant-based proteins such as quinoa, lentils, and tofu. Beyond protein, a range of micronutrients are equally vital. Iron is essential for oxygen transport to the hair follicle cells. Biotin is a key B vitamin involved in keratin infrastructure. Vitamin C supports collagen production and iron absorption. Zinc plays a role in hair tissue growth and repair, as well as regulating the oil glands around the follicle. Omega-3 fatty acids possess anti-inflammatory properties beneficial for scalp health. When these nutrients are insufficient, the body, being highly intelligent, prioritizes essential life-sustaining functions. Hair, being non-essential for survival, is often the first to experience resource rationing, leading to slower growth, increased shedding, and finer texture. This highlights why crash diets or significant caloric restriction almost invariably result in hair thinning a few months later. The practical implication here is to consciously construct a hair-supportive dietary pattern. This means starting the day with a protein-rich breakfast. Think 25 to 30 grams, such as Greek yogurt with seeds, eggs, or a protein smoothie. Incorporating fatty fish like salmon or mackerel multiple times a week provides essential omega-3s. Daily inclusion of diverse fruits, vegetables, especially leafy greens for iron and vitamin C, nuts, and seeds ensures a broad spectrum of micronutrients for targeted support. A high-quality comprehensive supplement specifically formulated for hair health, containing appropriate doses of biotin, silica, marine proteins, and other key vitamins and minerals, might be considered after discussing with a healthcare professional, and ideally following nutrient status assessment. Remember, hair growth is a slow cyclical process. The hair you see today reflects your nutritional status from weeks or even months ago. Consistent adherence to these nutritional principles therefore requires patience, with visible improvements typically emerging over 4 to 6 months. By addressing these interconnected factors, from gentle external care to managing internal physiology and optimizing nutrition, you are not just passively hoping for change, you are actively creating a more robust environment for your hair. Embracing a holistic perspective on hair health means recognizing that the vibrancy of your hair is often a reflection of your overall physiological balance. This includes not only nutrient absorption and hormonal equilibrium, but also the impact of stress physiology, the quality of your sleep, and robust circulation throughout the scalp. All these elements work synergistically to support active and productive hair follicles. The journey to healthier hair is rarely immediate. It is a testament to consistency and biological timelines. Expecting significant changes overnight is unrealistic, as internal shifts always precede visible results. Hair grows in cycles, and it takes time for new, stronger strands to emerge and become noticeable. Many individuals report initial reductions in shedding within a few weeks of implementing changes, followed by discernible improvements in hair texture and new growth around the 3 to 6 month mark. Some amount of hair shedding, typically 50 to 100 strands daily, is perfectly normal as part of the natural hair cycle. The objective isn't to eradicate all shedding, but rather to foster an environment where the hair that does grow is strong, resilient, and contributes to a sustained sense of density and vitality. Your hair offers valuable insights into your body's internal workings. Thinning or changes in hair quality after 60 are often signals that something requires attention, whether it's related to specific nutrients, hormonal balance, scalp health, or even your daily practices. By thoughtfully addressing these influences, you are not only supporting your hair, but also contributing positively to your comprehensive health and well-being. You deserve to feel confident and vibrant at every stage of life, and healthy hair is an integral part of that self-perception. Dismissing hair changes as an inevitable part of aging overlooks the significant agency you have in influencing your biological outcomes. Start with one manageable change, integrate it consistently, and then gradually build upon that foundation. Your future self, looking into the mirror at hair that feels thicker, healthier, and more resilient, will undoubtedly appreciate your commitment. If you found this exploration valuable and insightful, consider subscribing to our channel for more scientifically grounded health discussions. And we'd love to hear from you in the comments below. Please share your age and one specific aspect of hair health you find most challenging. Your experiences help us tailor our content to what truly matters to our community. This content is educational only and not medical advice. For persistent concerns, consult a qualified professional.